Hello and welcome to our live event tonight. It's 8 p.m. UK time, so it is definitely time to start our live event. Thank you everyone for joining us already. And of course, there's another topic and there's another special guest with us tonight. And as you can see her, Dr. Iryna Kotsiubska is with us. Hello, Dr. Iryna. How are you feeling tonight?
Hello, I'm fine, thank you.
Thank you so much
Hello.
for joining. Tonight we are connected with Lviv, which means that it's already 10 p.m. for Dr. Iryna. So thank you so much for joining our initiative, but also thank you for your time. I know it's quite late, but we are very, very happy that you are going to present for us tonight, and we are eager to find out a bit more on our topic. So, of course, as you know, Stronger Together has been brought to you thanks to all hard work from our team, but also thanks to our ambassadors and partners. So, as always, I want to mention them. You can see all of them right here. And of course, without them, it would be very tough to do it. So, thanks for their support. And as always, we will start with Dr. Iryna's presentation, and afterwards, it will be time for your questions. And all you need to do is type in the questions in the chat section so that Dr. Iryna can answer them for you one by one. Okay. And as you see, this is a very interesting topic and, of course, a very useful topic, I'm sure. So, successful IVF treatment after failed attempts. So, Dr. Iryna will start with her presentation, and I just want to mention that Dr. Iryna is working for Parens. She is obstetrician, gynecologist, IVF specialist at Parens, and I've mentioned located in Lviv. So once again, please let us know that you can hear us, and of course, we will start with the presentation. And Dr. Iryna, are you ready to start?
Thank you very much. I'm very happy to be present during my presentation. Today, I would like to speak about very difficult problem for some patients who tried yet IVF program, IVF treatment. My topic said successful IVF treatment after failed attempts. My name is Kotsiubska Iryna. I am a doctor of philosophy, obstetrician gynecologist, IVF specialist in one of the clinic in Ukraine, Parens, which situated in Lviv. What if my IVF cycle fails? Sure, when we start IVF program with patient, like a patient, like a doctor, we would like, and we do everything that the program would be successful. Because it's when we receive unsuccessful IVF cycle, it's very big problem for patients, for very stressed for patients, for doctor, because like a patient, like a doctor, we are stressed receiving unsuccessful results. But for a patient, when they have unsuccessful IVF, they pose some questions. Most important from them, it's should I try again with my ex, only with donor X, when I have had unsuccessful IVF with my own ex. How many cycles are enough for receiving a pregnancy? Are there any additional tests I can take for receiving a pregnancy next time during next IVF cycle? How to get pregnant after IVF failure? Can natural pregnancy happen after IVF failure? I would like to stop in some most popular questions. Here you can see in this picture what is this IVF, in vitro fertilization. In vitro fertilization, or IVF shortly, start before from examination of the couple, from examination of husband and woman. We do all examination for seeing if woman or man have some disease which can give us unsuccessful IVF, what we can prescribe more for receiving pregnancy. After that, we chose most a better protocol for ovarian stimulation, hormone therapy. We choose the dose of hormone therapy for receiving a good oocyte from our patient. Then, when we receive a big follicle, we prescribe finally hormone for receiving oocyte in each big follicle. After that, we do punction, egg pickup, aspiration, and give all receiving oocyte with follicle liquid to our embryologist. They look and examine each oocyte receiving from patient and give the qualification of this oocyte, because successful IVF depending from a good quality oocyte and a good sperm analysis from the man, and sure from a good uterine cavity. That's why we start from receiving oocyte of a good quality. Embryologist examine which good quality oocyte, and then we receive a sperm from his husband or donor sperm, and looking ensures a better spermatozoid for fertilization. After that, embryologist look for embryons during 5 days, choosing a better embryons for transfer. And in this time, doctor, gynecologist, obstetrician, IVF specialist prepare a cavity for better transfer. In this case, there are, of course, many factors that play a role in achieving the optimum quality of eggs, sperm, and uterine cavity. These are the immunological and hormonal, both male and female health, various chromosomal abnormalities, and medical history, to name just a few. Fortunately, clinics can now run a whole range of tests and screenings in order to help to provide answer and create a personalized treatment plan for each couple after many failed attempts. In this picture, you can see from the picture A, you can see a good quality oocyte with a homogeneous, bright ooplasm and an intact polar body. This oocyte can be used for the next step of IVF fertilization. In this picture, you can see a poor quality oocyte with many vacuoles, granulation, and a large perivitreal space. That's why this oocyte cannot be used for the next steps. The next steps, it's morphology of sperms. Like oocyte, we can see not the spermatozoid can use only normal spermatozoids, but sometimes we can see a sperm analysis with very much abnormal forms. In this case, we can't use abnormal forms, only normal forms spermatozoids for receiving a good quality embryons, because it's can give us failed attempts of IVF. how can we improve an oocyte quality? If we have, if we preview receiving not a big, not very much oocyte from the patient, in the case if she has had yet some IVF treatment, or if she has, if she is more than 55 years old, we can't receive very much oocyte for choosing some oocyte of a good quality. In this case, we have some methods for improving an oocyte quality. Here you can see some articles for improving oocyte quality with a medical treatment. One of them is which use very often. It's prescribing for patients melatonin, which they take 1-3 milligrams orally at 22 hours from the 5th day of the previous cycle to the day they were injected with HCG. It's if we can see some articles and in our practice we can receive more good quality oocyte. Like this, we have some medication, like some drugs, like vitamins, minerals, which can improve oocyte quality. But it's not for each patient. It's only doctor who decide if it will be if we can prescribe this medication or not, if it will be useful or not useful. In our clinic, we utilized very often assisted oocyte activation. For the patient who has had yet IVF failed attempts in IVF treatment, or if this patient is more than 55 years old, or if your antenatal hormones is lower than 1, or if we see a few antral follicles during the ultrasound, we prescribe or we received a few oocyte, maximum 6 oocytes after function. We prescribe this patient assisted oocyte activation. Its effects of assisted oocyte activation with calcium ion 4 and strontium fluoride on in vitro XC outcomes. What is give us is we can receive more good, more embryon of a good quality in the 5 days preparation. Here you can see in this picture how we can use a little bit this treatment. And what we can offer in case of male factor, how we can improve our IVF protocol if you have not very good sperm analysis. In this case, we propose our patients to do intraplasmatic sperm injection. During this IVF protocol, our embryologist, after function of follicle, when we receive oocyte, in the same time we receive the sperm from the husband of this patient, and our embryologist choose only one good spermatozoid and inject it into the cytoplasm of an egg. Here you can see this picture, how it's see in the embryology. The technique is used in order to prepare the gametes for the obtention of embryons that may be transferred to a maternal uterus. With this method, the acrosome reaction is started. The next procedure which we can propose, it's a PIXI. It's our embryology clinics. Here, I'm sorry. PIXI is a method of selecting the best possible sperm for fertilization before injection into the egg in the IVF protocol. Sperm are placed in the PIXI dish. Here you can see containing a sample of hyaluronan, a natural occurring biopolymer found in all human cells, hydrogel. In this gel, we can choose only the best spermatozoid, which will be injected into the cytoplasm of the eggs. After this method, we can receive fertilization of each oocyte, and after that we can receive some good embryons. Next steps, it's what we can do for receiving a pregnancy after IVF cycle. It's dependent from the good laboratory preparation techniques, incubators. In our clinics, we have only use modern incubators, microscope for ICSI injection, and other techniques for receiving a good embryons of a good quality. What we can propose as additional treatment options for the patient. When we can't receive all oocytes from the patient of a good quality, we can propose in this case egg donation. If we can't receive, if the male have not a good sperm, we can propose in this case sperm donation. And how I would like to stop in the program egg donors. Having our clinic have own egg donor bank, we can control the quality of material given to our patients. Egg donation is anonymous in Ukraine, and we strongly choose each our donors who must have maximum 30 years old, have your own biological and healthy baby, have no bad habits, must be physically and psychologically healthy, hasn't hereditary genetic disease. But if the patient can give us some her own good quality eggs, or not morally prepared only for donor programs, it's the same proposition for the male. If we have not good quality of sperm analysis, we can propose tandem programs. What is this? It's one is this program recommended. If the patient has had several unsuccessful IVF attempts with her own eggs, or if it's male with her own sperm. When we have a low number of good quality embryons after the embryo culture, when we have had a low number of eggs after the retrieval, or low anti-Muller hormone level. If the age of patient over 50 years, When we have poor sperm quality, or if we have cases when DESA is required. In this case, we use the oocyte from this patient and propose at the same time utilize donor oocyte. Why we propose this program? For doing ambulance in this shortly time and receiving in the same time some ambulance, we can propose for transfer for the patient. If we receive a good embryo with her own oocyte, we do transfer with embryo from her own oocyte. If we don't receive the good quality embryo in this program with oocyte or the patient or sperm of this couple from this couple, we propose to do transfer with donor material. And when we receive the embryos and the patients has had some unsuccessful IVF treatment, we can propose the preimplantation genetic diagnosis. What is this preimplantation genetic diagnosis? It's a reproductive technologies used along with an IVF cycle to increase the potential for successful pregnancy and delivery. PGD is a genetic test on cells removed from embryos to help select the best embryos to achieve pregnancy or to avoid a genetic disease for which a couple is at risk. And that's why in this case we transfer only good and healthy embryo, who gives us very high IVF positive cycle. How we can see in this picture, we can see how we do this PGD genetic test. Our embryologists do embryo biopsy and give this material into the genetic laboratory, who gives us analysis of each embryos. If we have embryos of, we can see here selection of healthy embryos by gender, if it's a boy or if it's a girl. Like this, receiving these results, we with patient select with which embryo will transfer to this patient. For the next step, you can see embryo transfer in the picture. After receiving a good quality embryo, we do transfer with a special catheter in which we take only one or two embryos and put into the uterus with ultrasound. For seeing in which place we have to put the embryos for better implantation. Now, what we need for a good implantation? As for uterus, cavity uterus, we have to do a transfer during the implantation window. What is this implantation window? It's generally believed to take place from the 17th to 24th days of the menstrual cycle. During this time, embryonic development and endometrial preparation for the implantation are done at the same time. An embryo undergoes a different stage of blood vessels development before it implants into a receptive endometrium. In this picture, you can see which endometrium we would like to receive before for embryo transfer. In this picture, you can see laminar appearance. It's a good cavity uterus, which is very good for embryo transfer. The next step is we need to have endometrium 6 or more millimeters for successful implantation. This requires not only correct tissue structure and the right receptors and likely many other factors we don't know about yet, but also the right balance of hormone. In this slides, you can see optimal hormone levels. As you seen above, we need good levels of estrogen to prime and stimulate the growth of a receptive lining. We need good levels of progesterone to maintain it and to ease the contractility of the uterus during the implantation window. In some IVF cycle, the levels of these hormones are not ideal and are certainly nothing like the sorts of levels the body experiences in a normal menstrual cycle. This is why some IVF clinics prefer to transfer the frozen embryos in a natural cycle into a natural environment. For women who are trying to conceive naturally, making sure that their ovaries are functioning well will usually ensure that levels of estrogen and progesterone are optimal for creating the uterine lining conditions that promote implantation. And surely, successful IVF program is dependent on a friendly immune environment. The immune system plays a tertiary role in whether an embryo will successfully implant or not. Autoimmune disease or subtle imbalances in the immune regulation of the uterine environment can have a large impact on an embryo's attempts to implant. For example, elevated uterine levels of certain immune cells called natural killers. In this picture, you can see cells have been shown to impede successful implantation or establishment of pregnancy, as have activated T lymphocytes. On the other hand, the actions of some T cells and NK cells are necessary to promote a favorable environment for implantation. It's getting the balance right. In this case, we prescribe some immunological therapy for receiving a pregnancy. There are some medication who can be prescribed after transfer and during the first weeks of pregnancy. If we can receive the pregnancy or with donor oocyte or with own oocyte or with, after the tandem programs using all medication which I said, or if the patient has some problems with her uterus or endometrium, which we can correct with medication. In this case, we propose a surrogacy. Who can start surrogacy in Ukraine? It's a heterosexual efficient married couple who has contraindications to carry and give birth to a baby. They may use a donor's material only from one side. It can be either donor's eggs or donor's sperm. Double donation for surrogacy is illegal. who can be a surrogate mother? It must be a woman from 20 to 35 years old, has their own biological and healthy baby, must be totally healthy and be able successfully carry pregnancy and be approved by the medical staff of the clinic. Uh, all surrogate mothers are examined by our medical equipe. First of all, by our IVF specialist. Then they do all necessary tests, medical tests, examinations, and has all consultation from other specialists like um, um, therapist, endocrinologist, genetics, and psychologist. And if it will be necessary, by other specialists. And in the last picture, you can see our team who would like and do everything for giving a pregnancy of each woman who comes to our clinics and would like to be pregnant. Thank you very much. And I would like to ask, to give you to ask of all your questions, and thank you very much for listening to my presentation.
Wonderful. Thank you so much for presenting tonight, and of course for explaining all the details. And Dr. Iryna, can you hear me? Can you hear me?
How, here I can see a first question. What is your opinion regarding use of embryo glue? My opinion is very good.
Iryna, I'm sorry, just wanted to check. Can you hear me now?
Yes.
Okay, good. Sorry, it's all good. So thank you so much for presenting. Yes, we will go for your for all of your questions. There are a few questions right here. So of course, let me go to. I will show this to you.
Thank you very much.
Okay, so you can see it. So let's start with the very first one. Of course, we will answer all the questions. It is a little bit longer one. So let's have a look. Okay. Firstly, I used to be Parens patient for 5 years, and I truly recommend this lovely clinic to everyone. Now, for some technical convenience, started double donation program with another clinic. I received 5 embryos. Is this a good number? I have 3BA, 3BB, which I will transfer in a week's time, and I froze 3 embryos for BB. I was expecting to get a lot of A quality embryos. Is this normal to receive A? A. Also, my new clinic don't freeze any Cs. I know that parents used to transfer Cs. Why is this so different in clinics' attitudes? All my C embryos were not frozen. Now I am a bit concerned. And greetings to your lovely team. Thank you so much for your very first question.
Okay, thank you for your question. I would like to excuse me for my not very good English. I try to speak better. What about your question? You received 5 good quality embryos. It's a good embryos for receiving a pregnancy. 3 embryos of 4BB. It's very good quality in our clinics because we speak a lot with our embryologists, and we know which embryos is good. And seeing your picture, it's you can be pregnancy if you with 3 embryos 4BB. It's a good quality. We can use very often embryos of AA, and during our practice, sometimes it's better to receiving embryos of 4BB. It's better because it's uh, embryon 5AA, it's very seldom, and it's not said that this embryo can give us implantation. It's a little difficult to explain you because not mm, how we can see during the PGD tests, sometimes when we see a good quality embryons, we can receive not very good genetic analysis, often from 5AA embryons. In your case, you can be pregnancy. And what about embryons CC? It's very low quality and very seldom it's give us a pregnancy. It's better to do transfer with embryon BB or 3 or 4 BB or 5 BB or BA. This embryo can give us a pregnancy.
And
Thank you very
excellent.
much.
Thank you so much for your question, as I mentioned, and of course for your answer to that very first question. There are more questions up here as well. Let's have a look at the next one. I'm 38, have a small amount of endometriosis. I've had many failed PGS tested transfers. Could my endometriosis be the cause? What would be the next step? Should I consider surrogacy?
Um, uh, Thank you for your question. It's depended from stage of your endometriosis, because if you have not very difficult endometriosis without linings in your uterus, without any difficulty in your cavity uterus, it's not will be a big problem for receiving a pregnancy. First of all, I would like to ask you if you ever done hysteroscopy, and if everything is good during the hysteroscopy, you can try again to do a transfer with in your uterus of embryons. If everything is very good with your endometrium, I don't think that endometriosis uh, can be a big problem for unsuccessful pregnancy, because in our practice we have unsuccessfully a lot of patients with this disease, and which receive your own pregnancy after IVF program. And for my mind, it's not a big problem for unsuccessful IVF cycle. It's dependent of a hysteroscopy picture, and I would like to see your hysteroscopy results if you ever done this.
And again,
And
thank you.
if
Mhm.
yes, yeah, and if you have some problems with the endometrium, sure, the next steps it's surrogacy. But if you have a good endometrium, you can try it again.
All right, excellent. You can see, of course,
Yes,
Kirsty has had a
yes,
Christian.
because yes, it's not a very big age of this patient, and if she has good results of your hysteroscopy, I think she can try again before using surrogacy.
And wonderful. Thank you so much for that once again. And let's have a look. Of course, there's
Thank you.
another question coming up, and it's right here. How much is your donor and surrogate mother package, embryo transfer package, and surrogate mothers packages? Do you offer live birth guarantee? And are you in Kiev?
Thank you for your question. We It's will be a question about our guarantee packages and surrogacy packages for manager, because I do only my medical practice, my medical treatment, like IVF specialist, and I don't know very well which packages we have, because it's a lack of our manager equipment. And what about situation in Kiev? We are only we have only one clinic in Lviv and some clinics in Poland. And what about surrogacy? We have only in our clinic, which situated in Lviv. And I can show your question for manager teams, and they give you an answer. Thank you.
Of course, thank you so much for that as well. And I just want to mention that, of course, you can also get in touch with Dr. Iryna and her team using this link I have just sent. There's an option to contact the clinic directly, and of course, that way you will be able to find out a bit more on the packages. Yeah, exactly.
Thank you.
Thank you so much. And let's have a look. Of course, there is another question right here. How many embryos will you transfer? What is your view on IVF and BMI?
Thank you very much for your question. We can transfer maximum 2 embryos, because more it's not very good, and in each countries, like in Ukraine, it's recommended to do transfer only with 1 embryos or 2 embryos if the patients would like, and this patient hasn't any problems for having 2 embryos and 2 babies. And what is my second question? What is my view on IVF and BMI? Sure, IVF gives more chance to receiving a pregnancy, like BMI, because it gives us we can receive a pregnancy in our clinic gives pregnancy after IVF treatment 70%. And during IVF program, we can see which embryos, how many embryos we receive, which qualities of oocyte we received before receiving embryos, and we see the sperm analysis and each spermatozoid before doing fertilization. And that's why IVF is a more successful program than BMI. And for my mind, if the patient is very younger than 30 years old, and without any disease, without any problems, and your husband has very good sperm analysis, or in this patient hasn't any problems but hasn't a husband, we can start and hasn't any problem, gynecological problems, we can start surely from BMI, and who gives not very high, not give us very high pregnancy, but it's a very resulty programs too. And we have a pregnancy after this program too. And we recommend guys to start from this program in some case. Thank you.
And thank you so much once again for this question, indeed, as well as your explanation to that one. Another question is a bit longer one, okay? But of course, let's have a look at it. I am
Okay.
47 with a failed DD frozen embryo transfer with blastocysts from 8 eggs and being told by day 3 days to go till transfer. There was 5. On the day of transfer, whilst in the clinic, there was only 1 left. I was assured it was the lucky one. I appreciate that Europe clinics are good, but coming from London, I felt I was just a number and that there was no care of concern having spent so much money.
Um, Thank you for your question. I think that you have had this program with your own ex, and how we can see, if I understand very well, we received only one good embryo of a good quality in the 5th day. Or transfer was where was 5? If you have used your own OOCYTE, in your case, I would like to propose you tandem programs if you would like to try again with your own eggs, because receiving only one embryo after 8 eggs, and how I can see after age 40 years old, we can't receive very much good, very much embryon or embryons of a good quality. No, it was not my own ex, so told me it was not. Yes, um, yes, I am agree with your doctor. It's better to receive to take an eggs, a donor eggs. Maybe you have had some problems with sperm analysis of your husband, because if you use a donor eggs, you have received a little more good embryons, 2 or 3 embryons. Normally, when we receive 8 eggs, we have received 40% a good blastocyst in the day 6 of after cultivation. In this case, I would like to see a sperm analysis of your husband.
Okay, sorry,
Let
there is a
me
follow-up
answer
here.
this single one. I think that you can use one another donors, because normally we can receive a good one good embryo or 2 embryos after 8 good eggs, donor eggs, and good quality sperm analysis. If you would like, you can send in our clinic your history, and we read and can give you a better answer.
Yes,
Because
of course.
in your case, I have no your history. Yes, it's difficult to give you answer why you have had only one embryo. Because in my practice, you have received minimum 2 good embryos and surely a pregnancy.
All right, of course. Thank you so much
Thank
for
you. And
that.
you can receive your history for managers, and I give you an answer.
Wonderful. Thank you so much for that. And of
Thank
course,
you.
the
Thank
link
you.
is, you can find the link in the chat section. You can get in touch with Dr. Rina and her team, so they will be able to help. And there's a thank you as well right here.
Thank you.
And
Thank
next
you.
question is up right here. Which prenatal vitamins are the best that contain folate, not folic acid, in the Ukraine?
We have a lot of vitamins which is prescribed in Ukraine during IVF program or before uh, before pregnancy, natural pregnancy. Sure, it must be folic acid and vitamin E, and our my friends and gynecologist recommend us to prescribe omega-3. It's very good for receiving a healthy baby. That's why we prescribe these vitamins too. And vitamin D, if the patient has lower vitamin D analyze during exams, and we choose the better dose for this patient. What about other vitamins? It will be better to take 1 month or 3 months before pregnancy, like fertile care. It's a good vitamins from Great Britain. And Lviv, it's good vitamins too. There are prenatal, Vitrum prenatal, which contains all of needs vitamins for receiving a good pregnancy. But the most necessary is folic acid, vitamin E, omega-3, and vitamin D. But we have to choose a dose seeing results after the exams.
And thank you. There is only like a follow-up.
The folic acid synthetic. Can you send the link? What is his folic? We can prescribe not a folic. For my mind, I prefer folio if we talk about Ukraine, but this vitamins you can buy in other countries too, which contains not only folic acid for 400 milligrams, and in the same time this vitamins contain iodomarine, which is necessary for a healthy pregnancy, for good pregnancy. But folate, I don't like.
All right, of course. Thank you so much
I
for
don't
that. Understand.
Thank you.
And sorry, one more follow-up from the very same patient. So let's have a look. Okay, so is there no prenatal that only contains folate?
Prenatal that only contains fluid. Fluid, I don't folate. Okay. But there are some vitamins who contain folic acid. I'm sorry, I don't understand very good your question.
It's like a regarding the folate, yes? So folate. It's from the very same patients.
What is his folic acid?
So
I prefer folic acid. And
of course.
it will be good with iodomarine in the same time.
Okay, understood, of course. Thank you so much for your question.
I don't like, but it's
so,
my mind.
Of course, it's quite normal, of course. So thank you so much for your question, indeed. Okay. Sorry, again, there's a follow-up from the same patient, because if the surrogate mother does not know if she has MTHFR gene.
Thank you for your question. But all of us, all our surrogate mother do all necessary genetic analysis too. And if she has some problems with her genetic analysis, she can't be a surrogate mother. We examine very well our surrogacy mother because we are responsible for receiving a healthy baby for our patients. And we do the genetic analysis too for our surrogates mothers. Yes, for the surrogate mother, we do all necessary genetic screen analysis. Genetic areas screen disease get screened as a surrogate mother. Non-genetic screen disease. We do all necessary genetic screen analysis. We have a package. Know what she has happened most of all.
All right, of course.
Who can give us, yes, who can give us a disease for this baby? Because some genetic analysis, some genetic disease not can be transferred for surrogate mother. It's depended from a good material from mother and father give us or donor oocyte or donor sperm or from whose cells we take an embryo. We receive an embryo. It's not dependent only of surrogate mother.
All right.
And
Again.
like a surrogate one is for good pregnancy, not for receiving a baby, because we transfer an embryo without your cells, only using cells from patients or from a donor side, but not from surrogacy mother.
And thank you once
Thank you
more.
very much for your question.
Of course, thank you so much. And let's have a look at the next question we have right here. So, how to prevent uterus from cramping after transfer? Valium, Nospa? Anything you can add to that?
Transfer. If you, I prefer Nospa or papaverine. It's but at the first time it's dependent of a week. If we speak only after transfer, it's will be better to using only Magne B6. It will be better to a good pregnancy. It will be enough. And when we have some problems after transfer, in this case, we prescribe another medication like a Nospa or papaverine or another medication.
All right.
But it's enough prescribing Magne B6 if it will be necessary, or only progesterone. Thank you very much.
Thank you once again for that. Okay, next question we have from another patient. What is your opinion regarding use of embryo glue?
Thank you very much for your question. We use embryo glue too, and my opinion is very good. And we use this culture for aging for the patient after 35 years old when we receive a few embryos and a few oocytes. or if you have had unsuccessful IVF treatment before.
All
And
right.
we like this author too.
And excellent. Thank you so much. Let me just have a look as okay, there is a thank you
Yeah,
for thank you for answering
thank you.
this question. And let's have
Thank
a look
you.
at the next one. Do you do mitochondrial transfers or pro-nuclear and spindle transfer?
No, thank you for your question, but in our clinic, no, we don't do.
Of course, thank you for that clarification. And let me show you the next question. So I have had repeated implantation failure of 6 good quality blastocysts. I am just 33, although husband has very low sperm count. Is there anything I can do about the failures, or are there any tests to explore?
Thank you for your question. If it's only problem in a low sperm count, we can propose you like I show in my presentation a tandem program using a low using sperm from your husband and from donor. If it's only this problem, or to do a PGT analysis from your blastocyst using a sperm from your husband. To think if you have a good quality genetic blastocyst. Because we can see a good quality blastocyst, but receiving not very good genetic analysis. You have we can propose you two program or genetic analysis or both program at the same time, or using a tandem program, a sperm from your husband and donor sperm. Thank you.
Thank you so much for explaining this question as well, of course. And let me just have a look again. Yes, there's a thank you from the patient here. Okay, it looks like we will be slowly finishing, like 2 questions left. So this is like a final call for your questions. If you have any left, go ahead and type those in the chat section. And let me go to the next question. What are the actions you offer post-implantation? Example, do you monitor progesterone levels and adjust medication accordingly? How do you proceed with patients from abroad?
Thank you for your question. Yes, we if we speak about IVF cycle during a stimulation before uh, function of follicles, we monitor progesterone levels and estradiol levels. If it uh, for taking a decision, if we do transfer in the same cycle in which we have we have done a function of follicle pickup of oocyte, or if we need to do transfer in the next menstrual cycle from the defrozen embryons. And when we do transfer in the next cycle, menstrual cycle, we do sometimes prescribe progesterone levels if it's necessary in this case of regarding in the history of each patient and prescribe if it's necessary during the preparation in the medium or after embryo transfer. If we think that she can has a low progesterone levels after embryo transfer. What about patients from abroad? We all of time, especially during a program or after a program, from starting working with us to receiving a baby. All of time we speak with our patient from abroad by mail, by messenger, by WhatsApp, and give them our recommendation, our prescription during all program and during all pregnancy.
And wonderful. Thank you so much once again for
Thank you very
that
much.
as well. And well, it seems that we will go to our final question for today. So let's have a look. Do you recommend steroids to patients who have multiple sclerosis to aid implantation?
Thank you for your question. Yes, sometimes I recommend steroids to patients who have multiple sclerosis to aid implantation, but it's dependent from the patients because there are many other medications which we prescribed in this case. Thank you for your question. We
And of course,
know we have no history of this patient. Yes.
Of course, understood perfectly. So, huge thank you to all of you for your questions. And of course, I believe it was very useful to you. And let me remind you that if, of course, you would like to get some more details and have possibly even some consultations, etc., all you need to do is just go to that site that I will send in a second. And of course, you will be able to get in touch with Dr. Iryna and her team. And I'm sure they will be more than happy to assist you. And Dr. Iryna, thank you so much for today. You have been wonderful with all the questions and your presentations. It's great to have you with us. And well, is there anything else you would like to add?
Thank you very much, and I'm waiting for your other questions. Um, Sending us in our mail or in other messengers. We give you an answer.
Wonderful.
Thank you.
That's
Thank you
Thank you
very
so
much.
much. And of course, there are some
Thank
thank
you.
yous
Thank
coming up
you.
right here. I just want you
Thank
to
you.
see it. And of course, greetings for
Thank
all
you.
your
Thank
time.
you.
Wonderful. All right,
Try to
everyone.
help all our questions. We do
Exactly.
everything for receiving a pregnancy.
Yes,
Thank
that's always
you.
the case. We fingers crossed for all of you, of course. So thank you so much for joining. And I just want to mention that, of
Yeah.
course, we will be back tomorrow at 8 p.m. UK time. So we will have another topic to discuss. So I hope you will be able to join us as well. And today, of course, this has been recorded. So you will have a chance to watch this once again. It will be uploaded on our YouTube channel and myivfenses.com. It will be uploaded tomorrow. So you will have a chance to watch this once again. And of course, I can only encourage you to sign up for our upcoming events. We will be back tomorrow, but also we will be back next week, same time as always. So thank you so much for joining. And Dr. Irina, once again, thank you for your time. So have a lovely night, and everyone, wherever you are, have a lovely day, have a lovely evening, and till the next time. Thank you.
Thank you. See you the next time and waiting for your question.
Yes,
Thank you.
exactly. Thank you so much. Bye.
Bye.